So here's another question. Can the brain make pain even if there is no tissue damage? Can the brain make pain even if there's no tissue damage, even if there's no danger signalings coming from a body part? The answer is yes. The brain can make pain even if tissues are not injured. And this is where it gets a little deep. We have to realize that our nerves in our body communicate with chemicals and electricity. The nerves in our brain are neurons. They too communicate with electricity and chemicals. Our thoughts and our emotions are nerve cells communicating just in our brain. The whole nervous system is connected and uses the same language of chemicals and electricity. Maybe we can illustrate it this way. If ever you had to do some public speaking, one of the top fears for most humans, uh, did you maybe have to use the bathroom beforehand? A little diarrhea urge before the speech? Or if you've been embarrassed in front of people, did you get flushed? Did your skin get flushed? You turn red? Well, in both of those cases, when you had to go to the bathroom, it wasn't some kind of intestinal bug. When you got embarrassed, it wasn't some kind of skin disease. Your brain felt threatened, and then it put out a physical response. Sometimes to alert you to a threat, maybe to give you a way out, perhaps to ask for some kind of support. But no tissue damage happened, and yet you felt GI distress. You felt some kind of redness, a flushness, a change to your skin. So the point is, sometimes our body can have a physical response to an emotion or a thought. And one amazing illusion or experiment that's been done, and you can actually do this as an exercise. Search the internet for the rubber hand illusion. And basically, the person in the experiment puts one hand on a table. Let's say they put their left hand on the table, their right hand under the table. And on the table, next to their left hand, is a rubber hand that would be their right hand. So the person leading the experiment strokes the rubber hand and the person's hand that's under the table at the same time. After about 2 minutes, when the experimenter simply rubs the rubber hand, the person in the experiment feels as if their right hand was being touched, even though it wasn't. The brain is amazing and it's complicated, but there was no activation of any of the sensors of that person's hand when the rubber hand was touched, and yet the person felt as if their right hand was touched. So the brain has an ability to make physical sensations even if there isn't any physical input to our body. So when it comes to pain, particularly chronic pain, we call that situation a highly sensitized nervous system. And so what we're trying to do with chronic pain is lower the sensitivity of that nervous system. And so we can think of our highly sensitized nervous system as an overly sensitive car alarm. If, let's say, the setting on the car alarm is so sensitive that merely a fingertip touching it sets it off, we know that that mere fingertip, a gentle touch of the pad of our finger, didn't do any damage, wasn't a threat to that car. But because of this alarm sensitivity set so high, it went off. Well, our goal is to lower the sensitivity of our alarm system, of our nervous system. And it's a very fluid situation. And perhaps you've noticed, if you have chronic pain, that let's say you went on a very relaxing vacation. Maybe you felt less pain when you were away on vacation. Could it be because there was less demand on you? Could it be that there was less threat, whether it's work or family or other life situations? So going away to a relaxing place caused pain to go away or lessen. Returning to the normal routine, the pain comes back. Did you get re-injured when you came back? No, but your circumstances changed. So we could say that in your normal circumstance, you're under more stress. And we'll talk more specifically on the physiology of stress later in the course, but we can call this bad stress, let's say. And what does bad stress do to our body? But it just makes us more likely to send danger signals to the brain. If you recall that illustration of the revolver, where you have to pull the trigger fully for the bullet to shoot. So same thing with the nerves. The nerve needs a certain number of sensors activated for the signal to go to the brain. Well, with bad stress, it's as if your body is already with the trigger half pulled. And that's with no tissue injury or anything. So if you're going throughout your day with the trigger half pulled because of stress, it won't take so much or as much to send a signal, a danger signal to the brain. So that's why, especially with chronic pain and what we'll call system-wide pain, our goal is going beyond the tissues where the pain is. It's really trying to affect the whole nervous system, trying to help decrease the stressors on that nervous system. And in fact, our system can get so threatened, so sensitized, and perhaps you're at that point where you can think about a movement that hurts you, and merely thinking about that movement made you feel that pain. That pain you felt and those people feel is real. That's how powerful the brain is in its effort to protect. If it thinks you're under threat, it'll try to protect you from doing something that's going to harm you or what it thinks is going to harm you, and it can make pain. And so there's a whole therapeutic approach called graded motor imagery, where people who are in so much pain, who can't hardly move, will practice little by little these movements in their brain, in their mind. And in time, they're able to lower their pain. So in our next section, we're going to talk about a very powerful emotion that is often found to be the root of pain, and that's fear.